You've had your annual blood test. The doctor says, everything looks normal. But you're still tired. You're foggy. Your hands feel cold, even on a warm day. You wonder, what's truly going on beneath the surface, beyond those seemingly reassuring numbers? This episode of GoldenGuidance looks beyond the basic lab ranges, delving into the nuances of what your bloodwork might not be telling you after 60. We'll explore those silent red flags, the subtle shifts in normal results that can signal underlying issues, like a low normal B12 level, unaddressed TSH, shifts indicating thyroid concerns, or the very early stages of anemia that often go undiagnosed. You'll learn how to ask better questions, understand what functional ranges truly mean for your unique body, and, most importantly, how to advocate for yourself in a medical system that, sometimes, unintentionally, overlooks the specific, age-sensitive needs of those of us over 60. Your well-being is a complex tapestry, and it's time to understand all its threads. As we gracefully age, our bodies embark on a gentle, yet profound, transformation. This journey brings wisdom and experience, but also subtle physiological shifts that standard medical interpretations sometimes miss. Think of your body as a magnificent, finely tuned orchestra. A single note might seem perfectly in tune on its own, but in the context of the entire symphony, it could be slightly off, creating a subtle discord that affects the overall harmony. Similarly, a single blood test result, while within the normal laboratory range, might not be optimal for your specific age and individual health profile. For those over 60, these nuances become even more critical. The very definition of normal can shift. What was perfectly adequate at 30 or 40 might leave you feeling suboptimal at 65. For example, while general blood tests like the complete blood count, or CBC, often show no statistically significant difference in reference ranges between healthy seniors and younger adults, some specific markers can tell a different story. Let's consider hemoglobin. While some studies suggest the lower limit for hemoglobin in seniors is similar to younger adults, others propose slightly different thresholds, such as 12.9 GDL for men and 11.8 GDL for women. A reading that's technically within the general, normal, range, but at the very lower end for your age might not be flagged as anemia. Yet it could contribute to that persistent fatigue you're experiencing. Anemia in seniors is multifaceted, often stemming from iron, vitamin B12, or folic acid deficiencies, or chronic inflammation. Understanding these subtle indicators is the first step in truly listening to your body. Then there's the quiet power of vitamin B12. This essential vitamin is crucial for nerve function, red blood cell formation, and DNA synthesis. Many labs consider a B12 level above 200 pg/ml as normal. However, functional medicine practitioners often suggest that levels below 400 or even 500 pg/ml can lead to symptoms like fatigue, brain fog, numbness, and even memory issues, especially in older adults. Your doctor might tell you your B12 is 250 pg/ml and say it's fine. But for your body, at this stage of life, it might be quietly craving more. It's like having just enough fuel to keep the car running, but not enough to truly accelerate and feel vibrant. These subtle deficiencies, while not pathological in the acute sense, can significantly impact your quality of life. The thyroid, that small, butterfly-shaped gland in your neck, wields immense power over your metabolism, energy levels, and even your mood. The standard TSH thyroid-stimulating hormone range is quite broad, often from 0.4 to 4.0 or 5.0 MIUL. However, many individuals over 60, particularly women, may experience symptoms of an underactive thyroid, even when their TSH is at the higher end of the normal range, say 3.5 or 4.0. You might feel perpetually cold, struggle with weight gain despite efforts, experience thinning hair, or find yourself unusually tired. These TSH shifts, while not immediately signaling clinical hypothyroidism, are whispers from your body, suggesting that your thyroid might be working harder than it should to maintain equilibrium. This is where asking for additional thyroid panels, like free T3 and free T4, can provide a more complete picture, helping to uncover those hidden imbalances. Kidney function, too, warrants a nuanced look. Creatinine levels, often used to gauge kidney health, can be less reliable in seniors due to age-related muscle mass decline. A normal creatinine level in an older adult might actually mask a decrease in kidney function. It's like measuring the water level in a bucket, when the size of the bucket itself has changed. This is why for those over 90, creatinine levels tend to increase, but for many under that age, they might appear stable even as kidney efficiency declines. This highlights the importance of not just looking at the number, but understanding what it truly signifies within the context of your aging body. Even cholesterol and blood sugar levels, while routinely monitored, carry specific implications as we age. For seniors, post-meal blood sugar levels and HbA1c, a measure of average blood sugar over several months, are increasingly recognized as powerful predictors of cardiovascular and cerebrovascular events, even more so than fasting blood sugar alone. A fasting glucose of 99 mg/dl might seem perfectly normal. But if your post-meal sugars are consistently spiking, your body is telling you something important about its metabolic health. The goal isn't just to avoid overt disease, but to optimize your health for vitality and longevity. So, what can you do to look beyond the surface? Firstly, understand that reference range is not synonymous with optimal range. Reference ranges are statistical averages from a large population, not necessarily thresholds for perfect health for every individual. Your optimal range might be narrower, more tailored to your unique biology and age. Secondly, don't hesitate to ask questions. If you're experiencing symptoms, even if your lab results are normal, voice your concerns clearly to your doctor. Ask if your results are optimal for your age, not just within the general population range. Inquire about functional ranges, and, if further testing, beyond the basic panel, could provide a clearer picture. Your health is a collaboration, and you are the most important member of your healthcare team. Thirdly, consider proactive measures. Regular comprehensive checkups are essential, especially after 50 or 60. These can include cognitive function tests for early dementia detection, regular screenings for common cancers, and bone density tests for women. But equally important is maintaining a healthy lifestyle, a balanced diet rich in whole foods, regular physical activity, adequate sleep, and stress management. These are the foundations upon which optimal health is built. Regardless of what your blood work might initially suggest, your heart has carried you through decades of love, loss, and laughter, accumulating a lifetime of stories. Now, it deserves a little extra care, a deeper understanding that goes beyond the conventional. It's about empowering yourself with knowledge, asking the right questions, and being an active participant in your health journey. For those over 60, true well-being isn't just the absence of illness. It's the presence of vitality, clarity, and enduring energy. By looking beyond the basic numbers, by listening to the quiet whispers of your body, you can truly unlock your potential for a vibrant and fulfilling life for many more years to come. Your body is a book of stories, and your blood work can be a crucial chapter. Learn to read between the lines, and embrace the beautiful, complex narrative of your health. Let's dive deeper into some specific examples of how seemingly normal blood work can still hide important clues, particularly for those of us navigating the landscape of life after 60. Take, for instance, white blood cell counts. The normal range typically falls between 4,000 and 11,000 per microliter of blood. While this range is broad, consistent readings at the very low end might not be flagged as critical, yet for an older adult, it could hint at a weakened immune system or even subtle bone marrow issues, making you more susceptible to infections. Conversely, consistently high readings, even if just above the normal threshold, could be an early warning sign of chronic inflammation, an underlying infection, or even conditions like leukemia, which become more prevalent with age. It's about recognizing the pattern, not just the single data point. Platelet counts also offer a window into your body's clotting ability and overall health. A normal platelet count ranges from 150,000 to 450,000 per microliter. While critically low or high numbers are immediately addressed, borderline readings for seniors require careful consideration. A slightly low count might indicate issues with blood clotting or bone marrow production, increasing the risk of bleeding. A slightly high count, on the other hand, could suggest an elevated risk of blood clots, which is particularly concerning given the increased risk of cardiovascular and cerebrovascular events in older adults. These aren't necessarily diseases in themselves, but rather indicators that your body might be operating with less resilience. Now, let's talk about liver function tests, specifically AST and ALT. These enzymes are key indicators of liver health. Normal AST is typically below 40 ul, and ALT below 35 ul. While elevated levels usually signal liver damage, they can also be influenced by factors like muscle injuries or even recent strenuous exercise. For seniors, it's important to consider that underlying conditions like fatty liver disease, which is increasingly common, might show only subtly elevated or even normal liver enzymes until significant damage has occurred. A trend of rising numbers, even within the normal range, should prompt further investigation, such as a liver ultrasound, to get a more comprehensive view of your liver's condition. This proactive approach can make a significant difference in preventing more serious issues down the line. It's not just about treating illness when it strikes, but understanding how to cultivate resilience within your body. The intricate balance of lipids, total cholesterol, HDL, LDL, and triglycerides is another area where context is paramount for seniors. While general guidelines exist, an individual's complete cardiovascular risk profile, including family history, lifestyle, and other coexisting conditions, must be factored in. For example, a normal LDL cholesterol level might still be suboptimal for someone with a strong family history of heart disease or existing hypertension. Conversely, for some older adults, very low cholesterol levels, particularly LDL, might not always be beneficial and could even be associated with other health concerns. The focus shifts from merely hitting a number to understanding what numbers are truly protective and sustainable for your unique longevity journey. It's about personalized medicine, not a one-size-fits-all approach. Beyond these specific markers, remember the importance of regular preventative screenings tailored to your age. This includes cognitive function assessments for those over 66, gastrointestinal screenings like colonoscopies, bone density tests for women, and targeted cancer screenings based on risk factors. These tests, combined with a meticulous review of your blood work, form a holistic picture of your health. Your engagement in this process is vital. Being informed means you can enter discussions with your healthcare provider as an active partner, not just a passive recipient of information. Prepare questions beforehand. If you're concerned about a specific symptom, ask for a detailed explanation of how your normal lab results align with what you're feeling. Suggest exploring functional ranges or specialized tests if you feel a more in-depth analysis is needed. Remember, your doctor is your guide, but you are the expert on your own body and its daily experience. By embracing this approach, by looking beyond the superficial, and by truly listening to the quiet wisdom of your body, you can transform your annual blood test from a mere snapshot into a profound conversation about your health and well-being. It's about empowering yourself to live your golden years with the vitality and clarity you deserve. Your body is a treasure trove of information. Learn to decode its messages, and embark on a path of informed, proactive health stewardship. This journey of understanding and advocacy is not just about extending your lifespan, but about enriching your health span, the years you live in vibrant health and with full capacity. Embrace this knowledge, and let your well-being flourish. If you found this helpful, please subscribe and take good care of your health.